Emotional dysregulation. Recently I feel we are hearing about this term everywhere. Everyone's talking about it, that, this is a state of emotional dysregulation, or she is, going through a dysregulation in her emotions. Now, what does it actually mean? This is Dr. V, and I'm going to be talking about emotional dysregulation and how it plays a role in our everyday lifestyle, in our relationships, in our work. And, every day we face the consequences if our emotions are dysregulated. So, by definition, emotional dysregulation is, I'm actually reading it out, is an inability to manage and control emotional responses resulting in reactions that are disproportionately intense, prolonged, or inappropriate for the situation. So, in simple terms, it means that when we are reacting to simple situations in an excessive manner, our behavior is also dysregulated. When we are unable to calm ourselves down, when we are in an overwhelmed emotional state, it completely and totally changes our behavior in certain challenging situations, that we face every day, sometimes in our life, in our personal life, or in our professional life. We are facing those kind of challenges every day. Now, why did I think about, talking about emotional dysregulation today? Is because it is directly related to homeopathy. Why? Because, if some of you who already know a little bit about how homeopaths work, we have remedy personalities, right? So let's say we have a chamomilla person who's getting excessively angry, who's getting excessively agitated. Or let's say we have an ignitia person who is getting excessively affected by, some disappointment that they have faced in life. Or we have a Nakswamika person. All of these are remedies in homeopathy. We categorize our patients sometimes by these personalities, and these remedies are then able to take care of the physical symptoms as well in that patient whose personality matches this particular remedy. Now, if you think about it, all of these personalities are emotionally dysregulated in one way or another. But we are going a step further to understand emotional dysregulation in an individualized manner for each and every person that we come across, or each and every person that we try to understand the case for. Um, in other words, without understanding at what level is our patient dysregulated, we are unable to apply homeopathy in the most deep sense of the word. And we are unable to use homeopathy if we are not looking at that important aspect of our patient's personality. So I just thought that emotional dysregulation itself is directly related to our remedies and how homeopaths work. So I thought I'll come down here and talk about it so that you know that you can use homeopathy in overwhelming situations, when you feel that you are unable to calm down, you are unable to, control yourself in certain situations. But even in those situations, if you're using homeopathy, we should be able to help you regulate those emotions in a very effective manner. Have a wonderful day.